Hepatitis A, B, and C are viral infections that affect the liver, each with distinct causes, symptoms, treatments, and prevention strategies. Below is a detailed breakdown of each type. Hepatitis A. Causative agent. Hepatitis A virus, HAV, a non-enveloped RNA virus from the picornaviridae family. Signs and symptoms. Incubation period, 15 to 50 days, average 28 days. Common symptoms. Fatigue. Abdominal pain, especially in the upper right side. Nausea and vomiting. Loss of appetite. Dark urine. Clay-colored stools. Fever. Jaundice, yellowing of skin and eyes. Joint pain, in some cases. Treatment. Supportive care. No specific antiviral treatment for hepatitis A. Treatment is generally supportive, focused on alleviating symptoms such as pain, fever, and nausea. Rest, hydration, and proper nutrition are recommended during recovery. Prevention and control. Vaccination. The hepatitis A vaccine is highly effective and is recommended for high-risk populations, example travelers to endemic areas, people with chronic liver disease. Hygiene, regular hand washing, particularly after using the restroom and before eating, to prevent transmission. Sanitation, proper food and water safety practices. Avoiding contaminated food and water. Hepatitis A is typically transmitted via the fecal-oral route, contaminated food or water. Hepatitis B. Causative agent. Hepatitis B virus, HBV, a DNA virus in the Hepatnaviridae family. Signs and symptoms. Incubation period, 45 to 160 days, average 90 days. Common symptoms. Fatigue. Abdominal pain. Jaundice, yellowing of skin and eyes. Nausea, vomiting. Dark urine. Loss of appetite. Joint pain. In severe cases, it can lead to chronic liver disease, cirrhosis, liver failure, or liver cancer. Treatment. Acute infection. Most people recover from acute hepatitis B without treatment. In rare cases, antiviral medications may be prescribed if the infection is severe. Chronic infection. Antiviral medications like tenofovir or entecavir can help reduce the viral load and prevent liver damage. Liver transplantation may be necessary in cases of severe liver failure. Prevention and control. Vaccination. The hepatitis B vaccine is highly effective and recommended for all infants, children, and high-risk adults. Avoiding blood and bodily fluids. HBV is spread through contact with infected blood and bodily fluids, example sexual contact, sharing needles, mother-to-child transmission during childbirth. Safe blood transfusions and needle use. Blood donations are screened for hepatitis B, and needles should never be shared. Hepatitis C. Causative agent. Hepatitis C virus, HCV, an RNA virus from the Flaviviridae family. Signs and symptoms. Incubation period, 14 to 180 days, average 45 days. Common symptoms. Often asymptomatic in the acute phase, many people do not show symptoms. Fatigue. Abdominal discomfort. Jaundice, in some cases. Dark urine. Loss of appetite. In chronic cases, it can lead to cirrhosis, liver failure, or liver cancer. Treatment. Antiviral therapy. The main treatment for hepatitis C is direct-acting antiviral drugs, DAAs, such as sofosbuvir, ledipasvir, glecaprevir, or pibrentasvir. These medications have high cure rates, above 90%, for most genotypes of the virus. Liver monitoring. Regular monitoring through blood tests and imaging to track liver health and detect any complications. Liver transplantation may be needed for patients with advanced cirrhosis or liver failure. Prevention and control. No vaccine is currently available for hepatitis C. Avoiding blood-to-blood contact. Hepatitis C is primarily spread through contact with infected blood, example sharing needles, unsterilized medical equipment, blood transfusions before screening. Safe sex practices, though less commonly spread through sexual contact, practicing safe sex can reduce the risk. Screening for high-risk individuals, people with a history of intravenous drug use, blood transfusions before 1992, healthcare workers, and people with multiple sexual partners should be regularly tested for HCV. Summary comparison. Feature: Hepatitis A, Hepatitis B, Hepatitis C. Causative agent: HAV, RNA virus. HBV, DNA virus. HCV, RNA virus. Transmission: fecal-oral, contaminated food/water. Blood, sexual contact, mother to child. Blood to blood, less common sexual contact. Incubation period: 15 to 50 days. 45 to 160 days. 14 to 180 days. Symptoms: jaundice, fatigue, nausea. Jaundice, fatigue, nausea, chronic liver disease. Often asymptomatic, fatigue, jaundice in some. Treatment: supportive care. Antivirals, liver transplantation, for chronic cases. Antivirals, DAAs, liver transplantation, for cirrhosis. Prevention: vaccine, hygiene. Vaccine, avoid blood contact. No vaccine, avoid blood contact, screening. Each type of hepatitis requires distinct approaches for prevention and management, and understanding the differences between them is crucial for effective control.